Good evening and welcome to the third installment of Jamaica Rising and Resilient, a continuing conversation with business leaders about the ideas and strategies to help guide the community back from the financial harms caused by COVID. In just a few moments, Greater Jamaica Development Corporation President and CEO Hope Knight will have the great privilege of interviewing President and CEO of the United Way of New York City, Sheena Wright, about her vision for a united way forward through these unique and monumental times, and how an organization like United Way continues to move the needle on equity and access for all. And now, it is with great pleasure that I welcome GJDC President and Chief Executive Officer, Hope Knight.
Good evening and welcome to the third installment of our series of conversations with important figures about the road to recovery in Jamaica, Southeast Queens, and New York City. Greater Jamaica Development Corporation is proud of the work that we've done and continue to do to improve the lives of the people who live and work in this community of color. A special and urgent focus has been providing guidance and assistance to the hard-hit minority entrepreneurs. Over the last year, we've distributed tens of thousands of pieces of PPE, met with 1,000 business owners, and through our CDFI provided $1 million in loans to businesses that might not qualify for traditional financing. We are now in the midst of administering a grant program providing over $10 million to effective businesses in Queens. We are delighted to have started this series back in November with Congressman Gregory Meeks, and in January with Borough President Donovan Richards. This evening, we are pivoting away from elected officials to chat with a true champion of underserved constituencies in New York City. Sheena Wright is president of the United Way of New York City, and it is fitting to note that during the month of March, which is Women's History Month, that she is the first woman to lead the organization in 80 years of its existence. Recently named as the #1 most influential leader in City and State's Nonprofit Power 100, Sheena is committed to strengthening families in challenged communities, providing access to capital for Black-owned businesses, and addressing structural and systematic failures which lead to racial disparities. I know this region has many challenges ahead, but I believe that Sheena Wright is going to be a part of this recovery for our region. Sheena Wright, it is my privilege to welcome you this evening. And I really want to thank you for taking part in this very important discussion that we're going to have this evening. So, you are at the helm of a very important organization here in the city focused on providing support to underserved communities. And when COVID hit, what were the first things that you thought about and wanted to mobilize your organization to do?
Thank you so much, Hope. Thank you for having me, and thank you for the great work that Greater Jamaica Development Corporation does. I appreciate very much the partnership. And it's incredible to know and imagine that it's been a year, right? And in those very early days, we sprung into action. When a disaster strikes, the United Way is called upon to respond. My first day on the job was Hurricane Sandy, so I felt like we were in that moment again. And so the first thing we did is raise a relief fund. And that was really to catalyze essential resources to meet whatever the immediate needs were. And at the time, we knew that those needs were people were losing their jobs. They needed access to emergency food, cash assistance. We knew that our education system shut down and that young people would need to be connected to remote learning, that teachers needed to support. So we immediately raised a fund that raised almost $15 million to really invest in the urgent needs of communities all across the city. But then what we realized very quickly is that this wasn't just like any natural disaster or some terrible event that might happen over the course of 1 or 2 days. But this was going to be a prolonged, like it's a prolonged hurricane, right? It's like, you know, on and on and on. And then we started getting requests from other stakeholders and communities and neighborhoods very early on in early April, as we were responding, you know, through our network of 600 community-based organizations. Other businesses reached out to us, small businesses owned by Black, Indigenous people of color, and they said, what should we do? You're the United Way. You help in times of crisis. What would you do? And so we immediately reached out to our partners in government to try to understand, like, what should we be doing? What's happening? And there was so much chaos in those early days. Our government partners said, you know, you're the United Way. Convene some folk and we'll work alongside you to kind of figure it out. The other urgent need that came to our attention was the testing deserts. Our government partners shared with us, you know, zip codes where if you walk 15, 20 minutes, you could not get a COVID-19 test. And those zip codes were Black and Brown communities. And because of our extensive network of partners that are culturally competent, trusted, they said, can you help us really, you know, kind of mobilize and have access to testing? So then we got into that. So it was, you know, I always said that I wanted United Way of New York City to be what New York City needed it to be. And in this moment, it was all of those things and more.
And did you see any special challenges here in New York City in particular, relative to maybe your colleagues around the country?
Well, New York City is like no other place, right? We are the most diverse community in the country, speaking 200 different languages, every religious background, every basically ethnic group. And what is so critical about how you respond in this moment, whether it's with individuals and families who need access to services, including health, life-saving services, or small businesses, is that you need to be culturally competent. There is no one size fits all in the city of New York. So if you are really trying to reach Black-owned businesses or Latinx businesses or, you know, immigrant-owned businesses, you have to have a specialized approach. If you're trying to reach individuals and families that are diverse, you have to make sure that you are really connecting them to organizations that they trust. And many other communities are more homogeneous than New York City. So you can do things at scale without being so precise and nimble. But that's what makes New York wonderful, but that was certainly required in the moment. And I also think that, you know, a challenge was, I think we all faced it, that our city and state were not aligned and coordinating and cooperating. And that really caused challenges on the ground in terms of how to navigate and get access to the critical resources. What were the clear directives on what we needed to do or couldn't do? So that I think is a particularly probably unique challenge to New York and other communities that have a bit of a dysfunctional relationship between the city and the state.
And it's probably a lesson for the future, right?
Absolutely, absolutely.
So we have had the opportunity to work together in the last couple of months, and you are the architect of this initiative, Together We Strive. So I want you to talk a little bit about the origin, how you thought about it, and a little bit about the initiative.
Sure, and I would say maybe I'm a catalyst for that, and it really, as I said before, was in response to direct requests that I received from Black entrepreneurs who, and in early April, said, "What should we do? We've been told to shut our businesses. We don't have any reserves. We don't know what's going to happen. Where should we go? You are the United Way of New York City. You are supposed to be here to help." And I got calls from businesses like an early child care center, run by Mama Janae, who's been a community stalwart. I got calls from businesses from local dress shops or the nail salon that I frequent and other places. And it was clear to me, because I had been following the effort that the city had been engaged in for a year before COVID, of really trying to look at Black entrepreneurs and really try to figure out what their needs were. Because before COVID-19 hit, only 2.5% of the businesses in the city of New York were Black owned. And that was stuck with me. That was like right here. And as I drove through my community in Harlem and I saw all those, doors close, I was thinking, oh my gosh, this is possibly an extinction level event in the city of New York for Black owned businesses. And we know that our percentage of ownership in the city of New York is lowest by far than any other group. So I reached out to Deputy Mayor Phil Thompson, and he said, we're trying to grapple with the entire, everything happening. And we appreciate your interest in this particular demographic, and we'll send you other people who want to help. And as the United Way, if you can set the table and really help to develop some solutions. So I was immediately connected to Wole Kopsum at Mobility Capital Finance. He had reached out to the deputy mayor as well. And I really set the table with people who I knew, who were trusted and had all kinds of skill and expertise, and would be willing to kind of sit at the table and roll up their sleeves. That included Blondell Pinnock, Chief Operating Officer of Greater Jamaica Development Corporation, a former Chief Lending Officer at Carver Bank. That included Perch Advisors, which is a company that supports bids in the outer boroughs all over the city of New York. It included Hester Street, which had done much of the research and mobilizing to understand what was happening with Black entrepreneurs, and others. We brought in Lisk, and we really looked at what Black entrepreneurs said they wanted and needed. They need access to capital, but the capital has to be designed to meet their needs. They needed grants and loans, but what they really, really said very loudly that they needed and that they wanted was technical assistance, capacity building, and community. They wanted to be able to network with one another, to share and leverage what one another was doing. And they wanted there to be, better opportunities in terms of procurement, whether it's with the city or other private companies. And so we listened, and we really, over the course of several months, met very regularly and developed Together We Thrive. And it really is based on that principle of kind of, collective work and responsibility, that the way we get through this as a Black community is together, and that there is so much power in our collective innovation and our collective work to move us forward. and it has launched. We're so happy to be launching it, and we're focused on specific neighborhoods and communities that have the highest concentration of Black-owned businesses, including in Southeast Queens, Harlem, neighborhoods and communities in Brooklyn, in every single borough. And, business owners have entered the Together We Thrive platform and network, and they've immediately been matched with technical assistance, coaches, mentors in response to what they say they need. And they're also now a part of a community where they are sharing and leveraging, what works, and also being able to work through problems together. It's such, to be an entrepreneur, you have to be innovative. You have to have a level of optimism and risk-taking. And so the resilience of this community and this group is phenomenal. And with all of the supports that we're trying to make sure that are easily accessible to them, I have no doubt that we will rise from this experience even stronger.
What an incredible foundation to build upon as we move forward in this sort of post-COVID environment. So kudos to you on designing this initiative, because I think it's going to have a significant impact on getting entrepreneurs back to where they were post-COVID and even beyond.
Yeah, we definitely be beyond. Yes.
Yes. So you talked a little bit about partnership a minute ago. And I want to ask you, how do you work with partners like Greater Jamaica and other community-based organizations to further your work and mission?
Everything we do is through partnership. Our job is to be the backbone in networks of people that are experts, that have skills and capabilities, and to help them and support them in working together to solve a problem. Everything we do is in partnership. And while we are a grant maker in a philanthropic organization, we don't look at our grantees. I don't even know that we call them grantees. We call them our partners. And our job always has been to make sure that organizations not only have resources, but that they have technical assistance and capacity building. We're a trusted partner where our partners and our organizations that work with us can really tell us, like, we need help here. This is not working. Traditional funders, and I ran a direct service organization for about a decade. You want to be on your best behavior. You're like, oh, this is the dog and pony show. Everything is great. Just give us the money. We'll get the work done.
Right.
With United Way, it's like, no, this is broken. I need some help with this. And I need money to get the work done. And we're like, okay, that's what it is our job to do. But we fundamentally believe that if everybody is working in a little silo, just doing their little piece of the work, you'll never, ever really solve the problem. What you'll have are these little islands of success. And we'll still have the chronic systemic challenges that we've always had. So the only way to really move the needle is through collective action.
Yes, very much so. So tell us a little bit about your efforts to create access and equity in this vaccine distribution.
Oh, yes, absolutely. We have always been a racial equity and social justice organization. The United Way of New York City has always worked on behalf of and in support of Black, Brown, and Asian communities in the city of New York. And what was so striking was the disparate impact of COVID-19 on communities of color. Right now, we have about 62% of all COVID-19 deaths in New York City are Black people. The highest rates of infection. And it's just, you can't get any more dire just when you look at disparities as it relates to life and death. There was just a study that came out that showed that the life expectancy of Black men decreased 3 years. By 3 years, and since last year, the biggest drop of any other group in the country. And we deeply appreciated these divides before, right? In terms of access to quality healthcare, in terms of the underlying health conditions. We know that our neighborhoods and communities, through environmental racism, have the highest preponderance of asthma because that's where all the bus depots and waste treatment centers are. We know the lack of access to healthy, nutritious foods. We have some of the highest rates of diabetes and hypertension and other issues. And then on top of that, we didn't have access to testing. So that spurred the spread of the disease. People didn't know they had it. They were walking around, they couldn't get a test. So we knew that we needed to address this. So we were able to partner with Quest Diagnostics and create and support this initiative called Choose Healthy Life, and really partner with my mother, who is a public health advocate and champion, to really kind of revive and bring forward a strategy that she started when the AIDS pandemic was disproportionately impacting Black people. What we knew is that we needed to go to our trusted institutions that were culturally relevant and competent and make sure that they had the resources and the infrastructure to meet the needs of community. So the church is where people go to get emergency food, to get counseling, to bury your dead. The sick and shut-ins get a level of support. So our work is resourcing a public health navigator, a professional paid person that is an employee of the church that is helping get access to testing for the broader community, as well now as the vaccine. And we want to build that infrastructure so that they're also helping to do health prevention and really achieve health equity in their communities. Our communities and our neighborhoods need the resources and the infrastructure. When we have that, we can rise to the challenge and get to the solutions for our problems.
That's right. So as we think about recovery 18 months out, how are you thinking about, sort of mobilizing the United Way's resources so that we can have a more equitable, equal access to resources in this city going forward?
I think it's one of the things that kind of keeps me up at night. We are in a very unique moment. And I think what we have to realize is it's a moment. Mm-hmm. The window of opportunity for us to make meaningful, measurable progress around equity is like a window of opportunity that I believe will close. And we've got to get as much as we can as we move through it. We have a moment where people are talking about racial equity and social justice in ways that they haven't before. We have over 100 corporate partners. So they're all issuing statements, Black Lives Matter. They're like, what? I'm like, what? And they're like, okay, but now what do we do? Like, we want to do, our employees are demanding. These millennials are not playing. They're like, where do you stand? You can't be on the sidelines. You can't say, I'm a company and therefore criminal justice reform, I don't have any space there. They're like, their employees are saying you have influence, you have power, and people are learning about, structural racism. Like, how did we get here? It's not that people were just unlucky and therefore now they're vulnerable. It's the system was designed to create these disparities. And so people are demanding that the corporate sector also responds, not just the nonprofit sector, not just government. So from where we sit with our 100 corporate partners, our 600 community-based organizations, and a real trusted partner with government agencies, we said this is the moment where we have now launched a campaign for equity, where we're looking very clearly about the racial disparities around access and, like you said, opportunity. And we are bringing those three sectors to the table around education, around criminal justice reform, around small business, around, workforce development and around health and hunger. And we are bringing them together and we're saying there are several goals, meaningful and measurable goals that we're going to have about closing those gaps. And we're developing plans and strategies to have everyone work together to move those things forward. And so that is the moment that we're in. We have a once in a lifetime stimulus package and some other resources that we know are coming from the federal government. If we're not hardwiring those opportunities to be in service and support of Black and Brown communities, we will miss the opportunity. And the way the system is structured, it's structured so that we will not get the full benefit of those opportunities. So we're trying to be very focused and very deliberate in making sure that we are hardwiring those opportunities to communities on the ground. So that's going to be our urgent work, certainly over the next couple of years. And we're excited to be able to be in position to do it. And it's, as I said, it's going to take full partnership to get it done.
Well, Sheena, thank you for being a champion of the underserved and unheard in this city. You are a fantastic leader, and we so much appreciate you for the work that you do. And thank you for joining us this evening, talking about the work that you and your organization are involved in. And we will continue to lift you up and let us know if we can do anything to help.
Thank you so much, Hope, and thank you for your leadership and your partnership. You've been a beacon in your career for so many years, and I feel privileged to partner with you and your colleagues at Greater Jamaica as we continue the work for our community. So thank you.
Take care. Conversations like that really drive home both the urgency of the current situation and the importance of having the right people in the right job. We know that Sheena Wright is the right person for the job at this time to lead us through the challenges ahead in our post-COVID recovery. With great pride in my hardworking staff, I also know that the Greater Jamaica Development Corporation is on the ground meeting the considerable challenges facing our small business community, especially our Black-owned businesses. Since March of 2020, operating with a smaller staff and under difficult conditions, we've managed to connect and help thousands of people, the minority entrepreneurs who will lead Southeast Queens back. In my opening, I mentioned a new grant program we are administering that's directed over $10 million to eligible businesses in Queens. Our business services group processed over 330 applications in over a 2-month span in order to get the money out as quickly as possible. This is in addition to their regular schedule of webinars, loan packaging, one-on-one assistance, and PP distribution that they continue to do without interruption. And frankly, that's why it's so important that 100% of the funds raised from our Jamaica Rising and Resilient series goes to support the labor-intensive efforts of our business services group. So I hope that those of you watching this evening will consider a tax-deductible donation to GJDC. Easy links can be found on our website, and we are deeply appreciative of your support. And on our website, you can also access more detailed information about our projects and programs. Thank you for attending, and we look forward to seeing you at our next event.